This is Heather Curtis, and I'm doing a presentation for IEC 509, Leanne Young's class, on CMV and its effects on children and their educators. CMV is the most common virus that is transmitted to an unborn child. CMV is classified as a member of the herpes family. It is closely related to other herpes viruses that cause chickenpox, mononucleosis, fever blisters, and genital herpes. Like these other viruses, CMV can be dormant and then reactivate itself. The virus is carried by humans and is not associated with food, water, or animals. There are no true physical characteristics of CMV. CMV affects every child differently. The most noticeable characteristic of CMV is microcephaly, which is also known as a small head. In microcephaly, the fear is that the brain is also small and therefore will not grow and develop as the child grows and develops. For some children who are healthy, there are only mild symptoms, if any symptoms. However, if CMV is contracted during pregnancy, it can have devastating effects. CMV can cause numerous developmental concerns. CMV can also cause temporary effects such as liver and spleen problems, jaundice, purple skin blotches, lung problems, a small size at birth, and seizures. The permanent disabilities can include vision and hearing loss, mental disability, again microcephaly, which is a small head, lack of coordination, seizures, mental retardation, and ultimately death. In some children, these symptoms do not appear until months after birth. For some children also, they don't develop until a year of age. For many children, they can see and hear perfectly well up until a year of age, and then their sight and vision is lost unexpectedly. A child can pass a hearing and vision test at birth, and at a few months of age, they can no longer hear or see. This can be devastating to the family and also devastating to the educators who are trying to find ways to reach these children. Half of all expectant mothers have never been infected with CMV during early childhood or adulthood. About 1 to 4% have their first CMV infection during their pregnancy. Babies whose mothers have their first CMV infection during pregnancy have the most health problems. Most women have no symptoms. Therefore, there is no active infection symptoms. And although some do experience symptoms associated with something like mononucleosis or strep throat, these symptoms would include fever, fatigue, mental confusion, arthritis-like joint pain, headaches, low white blood cell counts. Between 50 to 80% of adults experience a CMV infection by the age of 40. Approximately 1 out of every 1,000 babies born in the U.S. will have a CMV infection. Out of these 10 babies, 1 will develop significant illness that includes nervous system damage or developmental disabilities. Around 8,000 children each year suffer permanent disabilities caused by CMV. Although once CMV is present in the body, it is incurable. There is no vaccine for CMV. CMV can be transmitted through saliva, blood, breast milk, and birth. If found early in pregnancy, an antiviral drug called gancavirin can be given through IV to the pregnant mother. This drug may help prevent and affect a hearing loss. However, this drug does have very severe side effects and has only been tested on children with congenital CMV, not healthy children with CMV. Diagnosis of CMV can occur through a routine blood test that looks for the IgG antibodies. If a person is tested for CMV and they have the IgG antibody, their chances of passing the infection onto the fetus is small, unless the infection has occurred in the last few months. If a pregnant woman is tested and has no IgG antibodies present, then the chance of infecting the fetus is high. If a pregnant woman should test negative, she would want to take extra safety and health precautions. These would include good personal hygiene, no kissing children under the age of 6 months on the lips, not sharing food utensils with young children, and if you work with young children, such as at daycare, try not to work with children over 2.5 years of age. Adults contact CMV through saliva, such as kissing and using utensils. Therefore, this is why working at a daycare with young children is not recommended for unaffected pregnant women. as an infected mother whose CMV infection is active can pass this infection on to her baby during or after birth. And again, the actual cause of CMV can be as easy as an infection we get in childhood. Usually it's spread through contact with other children in a daycare or school environment. The CMV virus affects a person after a herpes-related illness or is infected by another person. A person can be infected through transmission of saliva from an infected person. The implications for the educator can be enormous. The educator must deal with numerous factors including deafness, blindness, positioning difficulties, and dependency in ADLs. The teacher must have adaptive resources as techniques of testing a child with CMV to ensure they are learning. This could include a light box for children who have visual difficulties. It could include a hearing aid or teacher of the deaf to help with reinforcement of current lessons, and could also include numerous suggestions from PTs, OTs to position the child so they are getting the maximum benefit of the classroom and the education. In addition, children who have CMV need numerous pieces of equipment. As stated, their potential for skin breakdown and lesions are very high due to them not being able to reposition themselves due to weight bearing and pressure. Therefore, a child with CMV might not be able to tell you when they are uncomfortable, so the teacher must be more aware of this child and their body language so she can help determine this child's needs. The teacher needs to be aware that CMV is a life-threatening disease. An infection could set up easily. It could be fatal. Therefore, the teacher must always be aware that a child with CMV is struggling. There's no implication of microcephaly. With microcephaly, there is fear the brain will not have room to grow and develop. This can lead to learning problems, mental retardations, and developmental delays. This leads to individualized instructions and usually one-on-one aid for many children with CMV. A CMV vaccine, however, has been given the highest priority in medicine, but as stated, the devastating effects can be prevented. There are resources for educators who have CMV. The Center for Disease Control offers numerous website information about CMV infection, as well as suggestions for both parents and teachers. There's also numerous websites that give teachers information about CMV infections. One could be www.education.noaa.gov. The biggest asset, however, for children with CMV is early intervention and also prevention. If we as educators can help maximize a child's potential, then the child is much more likely to succeed and be successful in life. Thank you.